Thank you. This was great. All three presentations were incredible. So we started with Anastasia and talking about the importance of pretend play in early intervention to address cognitive challenges, strategies to boost pretend play and enhance learning. The pretend program aims to use play to enhance emotional understanding, emotion regulation, problem solving, and flexibility. Pretend play is related to being more creative, more social, more cognitively flexible, and to decrease problematic behaviors. Kids with PWS have deficiencies in social abilities and have rigidity in thought, and kids with PWS typically have challenge of pretend play as well. So why do we use pretend play? To strengthen adaptive abilities, to reduce cognitive and behavioral rigidity, to improve social engagements. And the findings were that the kids improved organization and imagination, an increase in the variety of play, an increase in idea generation and cognitive flexibility, identifying emotions, and increased affect. Strategies for facilitating pretend play, allowing the child to lead is more effective and helps them become more flexible. Modeling is important, showing them how to use objects in different ways and to keep them and to keep object transformation. Modeling, having characters taking turns. Prompting can encourage a child to use new skills, such as asking a child to come up with the ending. Subtle interventions are the most effective, and increased cognitive scores seem to be more successful. People with increased cognitive scores seem to be more successful. But may also increase parental stress may be a barrier. Kate then talked about can early intervention strengthen the cognitive capacity and deal with change. So executive dysfunction is something that we know that people with PWS live with, and executive functioning is the higher level of processes that control cognitive flexibility. So we know that people with PWS struggle with that. Task switching deficits. How does task switching impact behavior? Preference and predictability. People with PWS have a preference to predictability, a resistance to change, intolerance to uncertainty, and we see a need to do things the same way. Lots of questions. If anything changes, negative behaviors are often seen after that change. Change is one of their biggest triggers. So best practices is to stick to a schedule and to stay consistent. But we know that always sticking to a schedule can be impractical, and too much structure may impede the ability to adapt to change later in life. So the hypothesis is increasing flexibility in routine will lead to greater ability to manage task switching. Several families are participating. They gave the children perceived control by using a web-based game and planned in flexibility points, the wheel spins, giving the child more control of their routine, starting with small levels of flexibility and then building up on that. We had really good questions and discussions after both of those presentations. Then went to Karen for the challenge question and talked about late diagnosis. Knowledge of rare diseases is not sufficient in certain parts of the world, and the issue with therapists not covering insurance, the lack of follow-up for therapies, and then parents are expected to do those therapies. So the question is it possible for kids with PWS to catch up when they have a late diagnosis? And the discussion about early intervention and the benefits and how do we make this available globally? Even if therapies are available, does adding these on add to caregiver burnout? And then finally, can we use technology to teach and spread awareness to people who may not have the financial resources and may live too remotely to meet in person?